and Assalamualaikum. This video is about dysmenorrhea, a common disease that happens to women. We from S1 to O5F will present one by one about it, like the definition, the methodology, the result we got from doing survey on Google Form, and also the discussion. Before we get started, I am Farah Najwa and I'm going to give a brief overview or introduction of dysmenorrhea. Dysmenorrhea is a medical term that refers to menstrual pain. Dysmenorrhea, often known as period pain, occurs when a cramping pain affects a person's abdomen. The pain can be classified as light, which does not bother with daily activities, moderate, which interferes slightly with daily activities, and heavy, which prevents daily activities. Furthermore, dysmenorrhea can be divided into two, which is primary and secondary dysmenorrhea. So what exactly the difference between primary and secondary dysmenorrhea? Primary dysmenorrhea is a common pain in the lower abdomen that occurs before or during period and fades over time due to excessive prostaglandin level. It is very common in young age. What about secondary dysmenorrhea? Secondary dysmenorrhea, on the other hand, is a severe pain caused by a medical condition that worsens long after the period has ended. It is most commonly begins in women who are in their late teens or early 20s. What are the causes of dysmenorrhea? For begin, a hormone called prostaglandin causes muscle spasm in the uterus, which expels the lining. This contraction might induce irritation and pain. Prostaglandin level rise just before period begins. Let's take a look on what are the symptoms of dysmenorrhea. One of the symptoms of dysmenorrhea is abdominal pain. Next is headache or migraine, and also bloating, nausea, sleeplessness, sleepiness, difficulty concentrating are the symptoms that happen among them during period. Putting heat on the lower abdomen area is one of the things you can do to reduce period pain. It will aid in the circulations of blood and the relaxations of the muscle in the area. You need to fill the bottle with hot water, cover it with a towel, and place it on your lower abdomen. You could also try using prescription medication to help with the period pain. Panadol administration is one of the most frequent medicine. Ibuprofen or aspirin can also be used. However, they must be used with caution.
My name is Daniel Ashraf bin Salim, and I will talk about the problem statement of the case study. Dysmenorrhea is said to be on the rise, negatively impacting women's activities. It was thought to be beneficial to identify the risk factors for dysmenorrhea, as this knowledge is useful in developing management strategies. This pain is caused by natural chemicals called prostaglandins that are made in the lining of the uterus. Prostaglandins cause the muscles and blood vessels of the uterus to contract. This survey helps us to identify the factors and learn more about how dysmenorrhea impacts a woman's lifestyle. We can learn more about dysmenorrhea from the women who have experienced it thanks to the public surveys and questionnaires. The objectives of the case study is to investigate out how common dysmenorrhea is, how it affects women, and how they seek treatment. Next, to determine the variables that influence the prevalence of dysmenorrhea.
Hi and Assalamualaikum. My name is Asrul Amin bin Muhammad Isa. So for the next part, I'll be presenting about methodology on what kind of method did we use to conduct this project. So first of all, I want to clarify that we did this project during COVID-19 pandemic. So there will be no physical contact among the respondents. So moving on to the methodology. For this project, we took an approach by conducting an online survey and online interview. So, in order to minimize the risk of COVID-19 infection, all the survey and interview will be conducted fully through online. And the form link was shared online and it was closed once the number of respondents had already been made. So for the online survey, we decided to use the Google form. The reason why we opted to use the Google form is, first, it is free to access, where everybody can access the form through the share link without any payment involved. Secondly, it is easy to compile all the data, because after the respondent finish answering, all the data will be compiled into the graph and the editor can easily analyze the survey through the graph. Thirdly, it has a user-friendly interface where all the interface and the tools can be easily accessed by the editor to edit the form when it is needed. So what is the question that was included in the survey form? So firstly, we asked about personal details such as age and the occupation of the respondent. Next, we asked about basic details such as when did they first experience the period, for how many days did they usually happen, what type of symptom did they have during the period, and for how many days did they experience the symptom. Did the period affect their daily activities, and did they take any medication or treatment during the period. As for the interview, we use WhatsApp apps. Since most other people use this app, we decided to approach our close relative and our close friend to interview them. And for the interview questions, we based it from the survey form. So we did get a variety of response, since the interview is a bit personal and it can get the respondent to be involved more with the surveyor.
According to the chart, 93% of the 46 respondents are aged from 18 to 25 years, while 70% of them are aged of 10 to 17 years. According to the pie chart, 98% of the 46 respondents are students, while 2% of them are employees. The majority of the respondents are students. According to the graph bar, the most aged first period is at 12 years old with 21 respondents, followed by 11 years old with 9 respondents, 13 years old with 8 respondents, 10 years old with 3 respondents, 14 years old with 2 respondents, same as 15 years old, and only 1 respondent with first period at 16 years old. According to this pie chart, the majority of respondents, which is 96%, had a period in the previous 3 months, whereas 40% of respondents are not. The causes for not having a period are stress and abnormal period. According to this pie chart, 80% of respondents had moderate monthly flow, 30% have light menstrual flow, and the remaining 70% have heavy menstrual flow. According to this data, 67% of the respondents had 7 days of menstrual flow. Another 20% of the respondents had 11 days of menstrual flow. 70% had 9 days of menstrual flow, while the rest of it, that consists 2%, had 10, 11, or 12 days of menstrual flow. According to the graph bar, the most respondents are agreed that back pain is the most symptom that will be felt during menstrual pain, followed by sleepiness, difficulty concentrating, headache, bloating, nausea, sleeplessness, body ache, mood swing, fever, leg pain, and even diarrhea. According to the pie chart, 74% of the respondents has menstrual pain during period, whereas the other 26% had menstrual pain before period. According to this pie chart, 87% believe that menstruation discomfort affects everyday activities, while the remaining 30% is disagreed. According to the data, menstrual pain may have an impact on one's life, with the majority of respondents agreeing that bleed-through on skirts, dresses, or pants having the most impact on one's life during menstruation pain, since it can create embarrassment. Other issues include inability to exercise comfortably, mood disturbances, inability to get out of bed, forgetting or not having a pad on the first day of period, needing to cancel travel or any engagement, and missing their work. According to this graph bar, the majority of respondents agree that it only takes approximately 2 days following to resume their normal routine. However, some respondents take between 1 to 6 days, and just one of the 46 respondents takes roughly about 2 weeks. According to this pie chart, the 46 respondents of 80% have not used hormonal contraceptions. This includes pills, injection, patches, and the implant in the last 3 months, while the other, which is consistent, 20% have used hormonal contraception. This includes pill, injections, patches, and the implant in the last 3 months. For the last question, according to this graph bar, sleep is the most common therapy or remedy that respondents always take to cure menstruation problem. As reported by a total of 39 respondents, hot patches are the second most common therapy for menstruation problems, with 28 respondents, followed by hot bath, with 12 respondents, while 8 respondents believe that ibuprofen is the finest traditional therapy or remedy used to treat menstrual problems. 6 respondents agree that exercise is the greatest treatment or remedy used to treat menstrual problems. And finally, opioid has 5 respondents, followed by yoga, which has only 2 respondents.
Assalamualaikum warahmatullahi wabarakatuh. My name is Ain Atra binti Azlan, and for my part, I will present the discussion on the result from the online survey that we have conducted. For the first is about the age when the respondents having their first period. The result shown that the highest bar of the age that women getting a period is at the age of 12 years old. Normally, girls are having their first period at the age around 12. But girls also can get period early at the age of 10 or late at the age of 16, as shown on the graph bar of the result. Getting period early can be happen because of the change of the hormone, especially during the phase of puberty that happen around that age. Normally, the number of days for women are getting period is 1 to 7 days. From the result, we get 31 respondents that experiencing period normally in 7 days. Another thing that we can see is the 80% of the respondents are having the menstrual flow moderately, while 7% are having heavy flow when they are getting period. For the women that having a period more than the normal days, and if they experience a heavy flow that would not stop, they should seeking help from the doctor because it can be another serious health problem such as a bleeding disorder, polycystic ovary syndrome, pelvic inflammatory disease, or other problems. Secondly is about the respondents are having a period in the last 3 months or not, and 96% of them was said yes, while 4% from the respondents said no. Once in every month, women will experience menstrual cycle, but it could be missed due to some reason. It could be changed from the daily life routine like having a stress, gain or lost weight, doing intensity workout, and many other reasons. When our body is in the state of the pressure, our brain will instruct the endocrine system to release hormones that activate fight or flight response. And these hormones will restrict activities that are not necessary, such as reproductive system. This condition consists of ovulating, and the result that can be happen is miss the period. Several changes on your body weight also can lead to a condition known as secondary amenorrhea, which means that we can get miss a period for 3 months or more. Gaining extra body fat or loss can imbalance the hormonal and lead to stop your period. By doing some intense workout also can lead to this problem because the calories that being burned are more than the calories that you gain. It causes your body not having much energy to keep that state and cause to hormonal imbalance that can lead to the menstrual cycle to be thrown off. Usually, women are experiencing premenstrual syndrome. So, what is premenstrual syndrome? Premenstrual syndrome is the name of the symptoms that women experiencing a week before period. It is also can be happen during the period. From the result, we can see the highest symptoms that being chosen from the respondent were experiencing abdominal or a back pain. Having a back pain during menstruation is usually occur by hormonal fluctuations. Lower back muscles can be affected by prostaglandins, which is the hormone that secrete throughout the menstrual cycle to increase uterine contraction and shrink the uterine lining. Heavy contraction can cause low back discomfort by radiating pain from lower belly to a lower back. Mood swing, acne, sleeplessness, bloating, and headache is also the common premenstrual syndrome that happen to the woman before the period or during the period phase. It was not fully diagnosed why women experiencing those symptoms, but it may be because of the change in the level of hormone during the menstrual cycle. Does the menstrual pain affect the daily activities? 88% of the respondents choosing a yes, while 12% of the respondents was said no. It can be proved when the 26 respondents was said that the blood of period may be stained on their skirt, dresses, or pants. It is due to the heavy flow of the period, or maybe the position of the pad was not so fitted. The second highest thing that can affect the daily life is when the respondent had to cancel their social engagement. The situation is when they are having a menstrual pain, they choose to not be getting up from bed because they does not having too much energy to do so. So they tend to cancel all the appointment that can lead to some disappointment, and sometimes it also can affect our work. The menstrual pain effects on the daily activities according to the personal experience. Some people was experience the different thing, but the problem was only temporarily. It can change in a few days. So, from the result, we can see 25 respondents have said that only 2 days was needed for their daily activities to function normally again. For the treatment, there is no special treatment for the menstrual pain because it is not a bad disease. It is just a normal disease that only happens during the menstrual cycle phase, but we can reduce the pain by using several methods. From the result, the highest treatment that respondents choose was sleep. 39 respondents that choose sleep because by getting a sleep, our body will at the state of rest. So it can decrease a little bit of the pain because they did not notice what had happened to them in their sleep. The second highest treatment that being popular among the respondents is by placing the hot patches on the lower abdominal when having the cramps. Hot patches can relieve the contraction happen that cause the cramps on your lower abdominal. By getting some pain relievers such ibuprofen and opioids also can help to relieve the pain.
So, as a conclusion for this case study, we can conclude that the severity of dysmenorrhea in women is a serious health issue that has to be addressed. The prevalence of dysmenorrhea was high in our survey. Menstrual pain and symptoms are common in women indicating moderate to severe pain in association with a high number of menstrual symptoms. Interference with life activities should be effectively managed to minimize menstrual morbidity. Those women who do not respond to medical management should be considered for further investigation for possible underlying pathology such as endometriosis.